Hello, and welcome to Riverside's Heart Month lecture series. In honor of Heart Month, Riverside is excited to be presenting a new community lecture on a different cardiovascular topic each Thursday this month. Today, we will be focusing on heart failure to get a better understanding of what it is and to gain more insight into how the condition is managed. Our presenter today is Dr. Divya Gumber, who recently joined Riverside Cardiology Specialists after completing her fellowship in advanced heart failure and transplant. There will be a lot of information covered, but the beauty of video is you can rewind and visit any part again. Or for additional information, please visit the Riverside Heart and Vascular website at riversideonline.com/heart. With all of that in mind, let's get to tonight's presentation. Without further ado, I will turn it over to Dr. Gumber. Dr. Gumber?
Hello, my name is Dr. Gumber, and I'm a heart failure specialist at Riverside Medical Group. Today, I will be talking a little bit about heart failure, how it comes about, its symptoms, and treatment options that we have for heart failure. This is a diagram of your heart. Your heart has two upper chambers called the atria and two lower chambers called the ventricles. There's a right side and a left side to your heart. Deoxygenated blood, or blood that does not have oxygen, shown in this diagram in blue, comes in through the right upper chamber of your heart, goes to the right lower chamber of your heart, and then is pumped to your lungs to get oxygenated. Once the blood is oxygenated, which is shown in red, it comes back to the left upper side of your heart, from where it goes to the left lower side of the heart, and from there it goes to the rest of the body. The left lower side of your heart, which pumps blood to the rest of your body, is called the left ventricle. Heart failure is the leading cause of hospitalization for people over 65 years of age in the US. There are 6 million people in America that live with heart failure, and about 870,000 new patients are diagnosed every year. When your heart begins to what we call start failing, it doesn't stop right away. You can live years and years with heart failure, and there are medications that we can give you for preventing further failure of the heart. One of the leading causes of heart failure is when you have blocked coronary arteries or blockages in vessels that supply blood to the heart. When that happens and part of the heart muscle does not get enough oxygenated blood, it suffers damage and it could even die. And that could over time lead to heart failure. There are, however, other causes of heart failure apart from blockages in your blood vessels. Use of tobacco, use of other illicit drugs such as cocaine, heart attack, as we just alluded to, diabetes, abnormal heart rhythm, obesity, congenital heart defects, having years and years of high blood pressure, and certain chemotherapy and certain cancer treatments can over time lead to your heart muscle weakening, which leads to heart failure. Symptoms of heart failure are things like shortness of breath, fatigue, difficulty being able to concentrate, swelling in your legs, swelling in your abdomen, or maybe even the rest of your body, rapid weight gain, which you might think is real weight gain, but could just be fluid that your body is holding on to, lack of appetite and nausea with eating, and rapid heart rates. There are several diagnostic tests we can do to diagnose heart failure. We can start with lab tests. We can send you for a stress test on a treadmill. We can do a chest x-ray. We can do an EKG, an echocardiogram, which is an ultrasound of your heart, or a MUGA scan, or a cardiac catheterization. A cardiac catheterization is where we go in with a catheter and take a look at the blood vessels of your heart to see if there are any blockages that can be opened up and supply blood to your heart muscle. I do want to go over this number called ejection fraction, which is how cardiologists oftentimes define the functional capacity of your heart. Ejection fraction is a ratio of the amount of blood that is sent out to your body divided by the total amount of blood that was in the left ventricle. A normal ejection fraction is supposed to be somewhere in the range of 50 to 70%. When your heart begins to fail, or when the muscle of your heart begins to get weak, then this number or ejection fraction, or EF as we call it, does begin to fall. When this EF is in the range of 41 to about 49%, that is what we call borderline EF. So your heart at that point is weak, and you are definitely in the zone of heart failure, but it is borderline. Once your EF falls below 40%, it is pretty reduced, and you may begin to have a lot more symptoms associated with heart failure. And that is considered to be a more reduced EF when it's less than 40%. For patients that live with heart failure, it requires them to make changes in their lifestyle in order to cope up with this disease. It requires things like keeping an eye on their weight, because their body does tend to hold on to fluid, no smoking, no alcohol, no other illicit drug use, trying to engage in physical activity as much as possible and keeping your heart going, monitoring their blood pressure to make sure that it's in acceptable range, watching their diet, and specifically watching their sodium, their salt intake and their fluid intake, managing their stress, staying up to date with vaccinations, not just the flu vaccine, but also the COVID vaccine, for example, getting rest when they need to, and keeping very, very close eye on their symptoms, and also being very, very compliant with their medications. We have many different classes of medications that we can give you to help control heart failure. For example, beta blockers is a very common class of medications that heart failure patients are put on. Another very common class is diuretics, which are medications that help you get rid of water that your body is accumulating by urinating it. For example, Lasix is a diuretic. There's a whole team of doctors, including cardiologists, heart failure specialists, electrophysiologists, and cardiothoracic surgeons that come together to take care of patients with heart failure. Patients with heart failure can go through different surgical options and procedural options to take care of their disease process. For example, some patients may need an ICD or a defibrillator, which is similar to a pacemaker, but is a device that sits in your heart and monitors the rhythm of your heart. And if your heart was to go into a dangerous or fatal rhythm, then this device would shock you out of it. And it could be life-saving, as you can imagine. There are also other procedures, such as putting stents in your heart, called PCI, which is done by interventional cardiologists. Or some patients may need to go through CABG, or coronary artery bypass surgery, which is something that's done by cardiothoracic surgery. For patients that have very, very advanced heart failure, they may need an artificial heart, or what we call an LVAD device, which is a left ventricular assist device, which is a device that basically sits in their chest and does the job of their heart, implanted in patients. Some patients may need heart transplant if they have very, very advanced heart failure and heart failure symptoms. And there is a whole team of doctors that work together over years to help patients get through these surgeries and these procedures. So for patients that are living with heart failure, it is very important that they follow up with their physicians, their cardiologist, or their heart failure specialist in order to get monitored over long term, take medications like they're supposed to, follow their symptoms, change their lifestyle if they need to. And if their symptoms still progress despite these measures, then we work as a team to refer them to the right kinds of surgeries and right kinds of procedures that they need that could be life-saving for them. Thank you so much for your time. I hope you enjoyed this presentation. If you would like more information on Riverside's Heart and Vascular Services, you can reach our website or contact us on this number. Take care and be safe.
Thank you very much, Dr. Gumber, for sharing all of this information with us. It has been very educational and has certainly helped clarify what heart failure really is and all of the different approaches to managing the condition. I hope everyone enjoyed the presentation, and I hope that people have had a chance to listen to the other Heart Month lectures we have hosted this month. Please keep an eye out for future heart and health lectures that we will share on Riverside's various social media outlets, our website, and our YouTube channel. Thank you again for joining us, and I hope you have a great evening. Good night.